Endometriosis is a medical condition normally affecting women between the age of 25 to 40 years, and sometimes even adolescents. The condition is associated with endometrial lining that grows within the uterus. In normal cases, this endometrial lining thickens, breaks down, and results in bleeding or menstrual flow during the monthly menstrual cycle. In the case of a woman suffering from endometriosis, the same process takes place, the only difference being the location of the endometrial lining. The endometrial tissue is normally found lining the uterus, while in women and adolescents suffering from endometriosis, the endometrial lining is outside the uterus. Until now, there has been no significant breakthrough with respect to the cause of endometriosis. In most cases of endometriosis, the women and adolescents do not experience any significant symptoms as such. In cases where there are symptoms, the ones mentioned below are the most common symptoms. Common symptoms of endometriosis: pelvic pain. Pelvic pain is a symptom commonly seen in those women and adolescents suffering from endometriosis. One of the leading causes of pelvic pain in itself is endometriosis, but pelvic pain is also seen in women and adolescents who do not suffer from endometriosis. This pelvic pain is sometimes intense during the menstrual cycle and normally subsides after the menstrual cycle is over. Painful bowel movements. Painful bowel movements is another symptom seen in women and adolescents suffering from endometriosis. Painful urination. This is another common symptom experienced by those suffering from endometriosis. It becomes difficult to pass urine, and many women and adolescents also experience cramps simultaneously. Other symptoms: chronic fatigue and pain during intercourse are some of the other symptoms of endometriosis. Some of the rare symptoms of endometriosis include coughing blood caused due to endometriosis in the lungs, chest pains, and others. These are relatively rare symptoms of endometriosis and need to be checked by a doctor as soon as they are noticed. This helps prevent any further complications as well as ensure the endometriosis patient is put on the right treatment plan as soon as possible without wasting time. Each person who suffers from endometriosis will have a different treatment plan based on the symptoms and other factors. A diet high in fiber is said to help improve the overall health of the individual, in turn having a positive effect on the endometriosis condition. Saturated fat, if limited, also reflects positively on the overall health of the individual. Basically, any diet which comprises the right amounts of good nutrition such as protein, fiber, and others will help keep the immune system in good condition and also in maintaining overall good health.